Okay, Parkinson's disease. Really focused on this Parkinson's. I'm going to talk real quick about this one. This we think is genetic. We're not really sure. This is a progressive disease. Usually you get it as an elderly, although there is young onset like Michael J. Fox. He got it in his 20s. And it starts out just like with tremors usually. So you have tremors constantly. You have tremors of your lips, your face, your tongue, hands, arms, and then you end up starting to have more rigidity and jerky movement. So if you watch Michael J. Fox, you can see he's got jerky movement. He can't control his movements. So that's when we have this dyskinesia issue. There's akinesia, where all of a sudden you feel like you just can't blink your eyes. You have trouble swallowing foods. That's akinesia. Dyskinesia is where you're jerking. So what can happen with these people that they start getting stuck when they're walking, so they're like shuffling, but they're stooped over like this, and so they feel like they don't know what to do, so they end up falling over because they can't figure out, but they shuffle. So for teaching, we want to teach them, lift up your foot and put your foot down in front of you, lift up your foot. So that's part of the teaching, because otherwise they're at high risk anyways for falls. But these people, because their brain is not working, we think it has to do with dopamine. It happens in the basal ganglia part of your brain, which is why we give the carbidopa, levodopa, or vice versa. Cinemet is the brand name, but now it's generic. They put the two together to help prevent nausea and to help the other one work and help increase the dopamine levels in your brain. It's not a miracle drug, but it does help significantly. And of course, there's always studies out there for stuff. A common one also is pill rolling. You'll see them doing this with their hands. Also blank stares. So it might be a good idea, and I'll see if I can find a video of someone with Parkinson's. They have the blank stare, and they're just because they just can't smile. They can't, it's very difficult for them. And talked about the tremors. So with these people, they can have problems: anxiety, depression, as it says on your sheet, constipation, memory issues, erectile dysfunction, so the whole works. So it is progressive, and these people, you just want to make sure they're eating well, give them the medications, and avoid, skin breakdown, contractures, that kind of thing. But the major thing is that we want to help these people live the best quality of life as possible. So if we can help them with trying to walk better and giving them some skills that maybe they can learn early on, that will help. Even though I know it's progressive, we do the best we can. Maybe that will help. So these people, help them to not get stuck when they're walking. They don't want a wheelchair. They don't want that. So let's try to help them with that. And just know what the normal movements are. Also understand the difference between the side effects of the medications, because carbidopa, levodopa can cause dyskinesia, where they can start having more jerky movements, such as this. So this actually can be a side effect. So remember that is a side effect of the carbidopa, levodopa. So if somebody's doing fairly well and their pill rolling is better and they actually seem to be walking better, the rigidity is less, still having tremors, let's say, but yet now all of a sudden they're having these jerky movements, it's most likely from a side effect from the medication. And so that needs to be monitored. Many times they'll decrease the dose or take them off the medication. It's hard to figure out what to do. So, all right, that's it on Parkinson's.